Hi, I was just calling to give a report to the nurse taking over Nancy. I am Matt. I was the nurse anesthetist in the OR taking care of her today. I'm assuming this is Florence, the ICU RN that'll be taking over care. I'll be using the I Put Patients checklist, or I Put Patients First checklist if you just want to follow along. So, Miss Nancy, she's an 80-year-old female, full code, no known drug allergies, past medical history of coronary artery disease, hypertension, hyperlipidemia, AFib, degenerative joint disease, and then she had a 3-vessel CABG done back in 1997. She recently got diagnosed with a type 4 thoracoabdominal aortic aneurysm and came to us today for an aortic graft repair. She underwent general anesthesia for the procedure, and then we placed a few lines and drains on her. She has a 18 gauge in her left upper extremity, a 14 gauge in her left AC, a right radial A line, a left femoral A line, a right IJPA cath, and a lumbar drain that we placed. For therapeutic interventions, she received 1,000 micrograms of fentanyl total throughout the case. For induction, she received 550 micrograms of fentanyl, 4 milligrams of Versed, and then I paralyzed her with 10 milligrams of pancuronium. Intubation was fairly easy on her. I actually used a 36 French ET tube that we secured 22 at the teeth. Anesthesia was maintained with 100% oxygen and titration of end-tidal isoflurane at 0.9 to 1.3%. She did really well throughout the case. Hopefully she can get extubated in the ICU within the next shift or so. As far as her drips go, she's running propofol at 25 just to keep her sedated and comfortable with the ET tube. But she will need strict blood pressure management. I suggest that she gets her systolics between 110 to 130. Currently, she's not running any vasopressors or esmolol, but she does have phenylephrine or esmolol if needed. Also important that we keep her lumbar pressures below 10. So her current vital signs are blood pressure 120/80, heart rate 85. She's satting 97% on 100% FiO2, and her current lumbar pressure is 8. During the case, she had a instance where her SVR increased during the cross clamp of the aorta. We just managed that with nitroglycerin. And then the on-clamping of the aorta, she had some rebound hypotension, which we managed with incremental phenylephrine and crystalloids. So for fluids in and out, for in, she received 3 units of PRBCs, 2 units of fresh frozen plasma, 3,600 mils of crystalloid, 750 of colloid, and 855 of cell saver blood. For out, she had about 2,100 mils estimated blood loss. Urine output was 680, and her lumbar drained a total of 120 mils throughout the case. No outstanding intraoperative events occurred. Most recent set of labs that she got in, she got a hemoglobin of 11, hematocrit of 32.8%, platelets of 91,000, BUN of 20, a creatinine of 1.1, and her ABG showed a pH of 7.4, a PaO2 of 304, a PaCO2 of 29, and a bicarb of 20.5. My post-op immediate suggestions are to keep her systolics between the 110 and 130. I would notify a provider if her lumbar pressures remain greater than 10, or if she has greater than 10 mils of output of CSF for 2 consecutive hours. And then I would monitor her urine output closely. We're getting her ready to leave now. If you don't have any questions, we'll be in the ICU in about 30 minutes or so.